I'm Rob Tatro, President, Founder of the Canadian CMV Foundation. Thanks for joining today. We're doing a presentation today on universal screening for newborn babies and why we think it's dramatically beneficial for all newborn babies to undergo a universal screening protocol. Therefore, all babies that are born in Canada would therefore be diagnosed, potentially treated, and have dramatically better outcomes. So CMV is the number one cause of infant disability, and if you're here, if you're watching this, you probably care about it, you know about it, you've heard about it, maybe you're a healthcare practitioner, maybe you're a legislative body, but regardless, it means something to you. So I'm going to go right into it here. This is my son, Alexandre. He was born in 2008. He did not appear symptomatic at birth, and he would have been missed were it not for a late ultrasound. So when my wife and I, we decided we'd make a difference. We decided we'd do something about it. The result of that is the Canadian CMV Foundation. The sole mission of Canadian CMV Foundation is the eradication of congenital CMV infections. And we're doing that a bunch of different ways. One is advocacy. One is, raising awareness. One is funding relevant research. And we want to do that because we want to eradicate the number one cause of infant disability. My son is what would happen if my son is a result of the failures of the system. He wouldn't have been caught. He was symptomatic, but he wouldn't have been caught were it not for a random occurrence. So think of how many other babies out there are like my son that didn't get caught, and universal screening would catch children like my son and could dramatically improve their outcomes. So there's no standard of care that exists right now for protocols. Diagnosing needs to be done before 21 days. And there is a need to improve learning and to improve awareness for all practitioners. So that's what we're here to talk about today. So we're talking about screening. So let's get into screening. Criteria for newborn screening. So this is a 1968 World Health Organization paper, and it's kind of been revisited multiple times. But the criteria for newborn screening is it needs to be a public health concern. The natural history has to be understood. There needs to be an appropriate test. There need to be evidence that the screening improves the outcomes. And programs should provide health care or care after screening, available resources for diagnosis and treatment. It should cause no harm, and it needs to be cost effective. So I'm going to take you through this presentation, and by the end we'll have check marks next to all of these, and you'll understand why we are advocating for universal CMV screening for all newborns. So CMV, what you know about it, it is the most common congenital infection. It's a leading cause of sensorineural hearing loss. It's got a higher disease burden and causes more disability than all other congenital conditions that Alberta currently screens for. The costs are approximately $400 million annually in Canada. It is a huge, enormous health concern. And just so you guys know, this presentation has been done and prepared for the ministry in Alberta, the Ministry of Health in Alberta, and the Chief Medical Officer out there. But this does apply to every other single province. So just so you know, we'll be referencing Alberta throughout, but know that it does. It's valid for all other provinces, except for Ontario, who are already doing universal screening, and Nunavut apparently coming soon. CMV, we like to say it's the number one cause of infant disability. Number one cause of infant disability. If we take a look at the actual burden, this is the relative burden to other screening conditions. The top two there are hearing disorders and congenital CMV disabilities. CMV is the number one cause. It has the largest burden that is not, and it's not being screened for right now at all, higher than all of these other conditions that are currently being screened for. Now, if we take a look at the economic burden, CMV has more cases, more children are born with it with long-term impacts than all of these other conditions. So it's the number one cause. We're not screening for it. And today we're going to tell you guys why we should be screening and why diagnosing early is important. So why does it matter if we diagnose these babies early? Well, first of all, treatment of the symptomatic neonates is beneficial. So they're going to get improved hearing and improved cognitive outcomes. It is safe and it's well tolerated. Second of all, increased monitoring for CMV-related complications. So for the kids that are asymptomatic and that typically wouldn't be caught, increased monitoring helps, kidney and liver function, cognitive developmental delays, vision, and obviously the big one, late-onset hearing loss. So early intervention, healthcare-related complications for CMV reduces system costs. We're going to talk about cost effectiveness in a bit, but it's incredibly cost effective and it needs to happen. And finally, why we are here. We are a parent advocacy group. Families deserve to know, families want to know, and you cannot keep this information from families. So here's the burden in Alberta, the current CMV burden in Alberta. Roughly the amount of births that we expected in 2017, 2018, that's per year. The incidence number that you see there, 0.64, this is based on the NSO, the Newborn Screening Office in Ontario in 2016. And it's also based on, there's been dozens and dozens and dozens of studies that have been done on CMV prevalence. They range from anywhere to like maybe 0.4 to maybe like 0.9%, but generally, we use the 0.64 number, regardless what number you use, it's around there. That's the prevalence in Alberta that we expect. That means 360 babies are going to be born with congenital CMV. Of those, 10 to 15% are going to be symptomatic at birth. Of the symptomatic at birth, about half will develop a severe handicap. We're going to show later that most of these are never caught. And on the asymptomatic side, so these are babies that are not, they're not showing any symptoms at birth. About 46 to 49 will develop late onset hearing loss. So the symptomatics are going to be severely handicapped. Obviously, that's the cases of all the parents that you're on this phone call and that you likely have met, because those are the only ones that we're catching right now. Those are the only ones that we're catching are the severely handicapped. And then the asymptomatic, we're talking another 50 or so babies in Alberta that will have late onset hearing loss. Now, what is late onset hearing loss, and why does it matter? Sorry, guys. So late onset hearing loss occurs following congenital CMV infections, and CMV infected infants should be evaluated regularly to provide for early detection, hearing loss, and appropriate intervention. When you get late onset hearing loss, if you know about the diagnosis, so here this is Karen Fowler's study in 2013, Dr. Karen Fowler, they identified that kids need to be followed. On average, kids will lose their hearing anywhere from 6 months all the way up to 5 or 6 years of age. And these are all the babies that are symptomatic, right? And early detection is key because this goes without saying, but I'm going to say it anyways. If you can detect hearing loss early, you dramatically improve the potential outcome for that child. So this is a Morton and Nan study that said that they need to focus on the etiologic focus of the hearing loss. So what caused the hearing loss? Finding out the cause for the hearing loss is extremely important. So universal programs to screen newborns for hearing defects is extremely common, but we need to focus on the reason for the loss. And with CMV, we know the reason for the loss. We know that the loss is being caused, the number one cause of non-hereditary hearing loss is congenital CMV infections. Not only that, it's a huge economic impact. So the hearing loss is extremely, extremely burdensome on the economy. 1.2 million studies have shown that the damage, the cost, if you will, is $1.2 million per individual. So not only is there a dramatic impact on the children who have to suffer and go through this, the parents and the families that have to deal with this, the system obviously is paying, we're all paying as taxpayers, and there's a way to reduce this, all right? So sensorineural hearing loss due to CMV is treatable. This is a big one, it's treatable. So we know that a proven treatment exists. It's valganciclovir. The standard of care is 6 months, twice daily. It is oral. The treatment clearly leads to improved outcomes for symptomatic newborns and should be offered as standard of care. This is some huge developments that have happened in the last 10 or so years. When my son was born in 2008, he was symptomatic. He was treated for back then it was ganciclovir. It was through a PICC line. I spent a couple months at the hospital. It was a lot more difficult back then than it is now. And I was told he was the first ever child treated in Manitoba for CMV. So the key with these symptomatic babies is that they're currently undiagnosed. So studies are showing that about 1/6 of these babies, these symptomatic babies, are being diagnosed. So diagnosis would ensure proper follow-up. And not only that, but like these babies, the majority of severely affected infants, including those with neurological disease, are not being treated with valganciclovir. So Dr. Vaudry published a really important study in 2014 that showed that the present description of current diagnosis and practice highlights the needs for more complete case identification in the population, as well as the need for increased awareness of the optimal therapy for symptomatic CMV. So we know that there's all these symptomatic babies that are born. We know that for a fact. We know that the vast majority of them are not being diagnosed at birth, and therefore we know that these babies are not being treated. If they were diagnosed, they could be treated. It's a fairly simple concept. Symptomatic babies, standard of care agrees that symptomatic babies should be treated. A much better outcome will come from symptomatic babies. So when we get to asymptomatic babies on the other side of the equation, asymptomatic babies are rarely, if ever, diagnosed. So the asymptomatic babies, in here there's 306 to 324 asymptomatic babies currently being diagnosed, undiagnosed every year in Alberta, and about 46 to 49 are going to develop late onset hearing loss. Currently, I want to say none of these are identified, but I shouldn't say none. But like a very, very, very small portion of these babies are being identified. It would have to be a random, almost a fluke or a random occurrence for them to be diagnosed, because we know that even the symptomatic ones are being undiagnosed. So the asymptomatic ones are falling through the cracks. We know that anecdotally, and we know that through some research as well. So the only way to ensure that we catch these asymptomatic cases is through universal screening. Now, what would universal screening do? Well, first of all, CMV is detectable with a simple test at birth. It's got extremely high sensitivity, extremely high specificity, and it's done through saliva PCR testing. I mean, there's some thoughts about maybe doing some saliva dried blood spots, but right now, most hospitals, most healthcare practitioners are advocating for high sensitivity saliva PCR screening, and is now the accepted standard for screening. So a simple test can diagnose a child with congenital CMV. Now, screening must be administered early. We mentioned this earlier, but it must be administered in the first 3 weeks of the baby's life, because after that, you're not guaranteeing that your diagnosis is a congenital CMV. So testing for CMV in saliva, urine are both optimal before 3 weeks, because if not, it's possible that the child acquired the condition either in the vaginal canal, from breastfeeding, or just at the hospital. So we want to make sure it's congenital, because if it's not congenital, then the child is not a congenital CMV, and therefore doesn't need to be treated, if you will. I mean, there's still more research that needs to happen there, but effectively we want to catch the congenital CMV. Congenital meaning, spread, infection happened in utero during pregnancy, mom to baby. That is a congenital CMV infection. So screening is affordable. So although CMV tests can vary in cost, it's anticipated that a province-wide saliva CMV screen would cost less than $10 per test to administer. In addition, it's anticipated that as screening becomes more mainstream, costs will continue to decrease. Newer products are coming to market, and specifically a recent study showed that the tests can be done quicker and for less than $5 per test, and is now FDA approved. So we still have yet to see how that's going to impact the cost. But this is, I'm citing Dr. Soren Gant, who wrote the seminal, I'd say internationally renowned, published article on cost effectiveness of CMV screening. Dr. Soren Gant is a Canadian. He lives in Vancouver. He's an incredibly passionate, dedicated CMV specialist. He's written a bunch of published papers on CMV. He believes, in my conversation with him, he believes they can get down to $5 per test to administer. Screening is going to lead to cost savings. So we know that symptomatic babies that are currently being missed will be diagnosed and treating, leading to improved outcomes. So these are kind of the low-hanging fruits, if you will. So we know that 18 to 27 babies with severe handicaps are born every year, congenital CMV. We know that 18 to 22 of these go undiagnosed. We know that studies demonstrate that the current standard of treatment, which is valganciclovir, improves hearing outcomes for 55% of these newborns. So that's the actual test showed that 3/4 of the babies had an improved outcome, but about 20% or so had in the placebo group had an improved outcome. So the attributable increase due to the treatment is about 55%. So that means, if you do the math, we're talking about an improvement of 8 to 12 Alberta newborns every single year that are not going to lose their hearing, folks. That is the math on the symptomatic side. It is dramatic. Every one of those babies is $1.2 million during the course of their lifetimes. Every single one of those. You're preventing cochlear implants. You're preventing family anxiety. And, although Valgund cyclovir treatment of symptomatic babies may also result in improved neurocognitive outcomes, so studies have shown that the cognitive outcomes are better as well, but we're not even including these in the cost-benefit analysis. So the symptomatic babies will be diagnosed. They're currently missed, so they're going to be diagnosed and they're going to be treated and they're going to have a much better outcome. We know this statistically. We know these numbers. Whether it's 8, 10, or 12 is kind of semantics and details, but we know that there are going to be a lot of babies in Alberta every year that are going to have significantly better outcomes. Now, when we get to the asymptomatic, so among the asymptomatic babies, so the babies that are born without symptoms that are healthy at birth, they're going to develop late-onset hearing loss. And it's estimated, this is an extremely conservative estimate, but Dr. Gant estimated that there would be a 12% reduction in the cost of hearing loss owing to the earlier identification of hearing loss that results from CMV screening and audiological follow-up. The logic goes like this. I'm a parent. I find out my son or daughter has a CMV diagnosis at birth. My doctors tell me, all right, just so you know, your son or daughter is asymptomatic. However, a portion of these, a minority of these, less than 20% of these will develop long-term impacts. So whether it's hearing loss or cognitive impacts. So just keep an eye out for that, Rob. And I would go, thank you. And by the way, we're also going to schedule regular visits for your son to come in and get tested for vision, for ophthalmology, etc. So now we're monitoring this for more closely. And if we notice as parents that we think, our kids might not be hearing, we bring them in and then we can test them and then we can see if they're candidates for cochlear implants or whatever. And we're going to catch a lot more of these babies just by having parents aware and involved. So it's going to lead to cost savings. We know that for sure on the asymptomatic side as well. Universal screening guarantees cost savings. So this is the study I was quoting, Dr. Soren Gant, the internationally acclaimed study that was published about 4 years ago. Universal newborn screening for CMV infection is cost effective under a wide range of assumptions. Universal screening offers larger net savings and the greatest opportunity to provide directed care. This was published in a journal. It's been widely recognized as being a game changer. These findings suggest that implementation of newborn CMV screening programs is warranted. There is no cost argument. Even if testing costs are as high as $50, universal screening would be roughly cost neutral under some of the scenarios in his model. And these estimates are highly conservative given the experience with per sample PCR costs of less than $10 in other newborn screening programs. So, Dr. Gant went and did the calculation at $10, at $50. It's cost effective under a wide range of assumptions. And, he's convinced, and I speak to him regularly, that the cost will come down. Furthermore, newborn PCR-based screening programs for other diseases have already demonstrated the possibility for cost savings. So we're talking about other diseases. As you start to test more and more babies, you get more and more cost savings over time. You get more efficient at building the tests. And, in this case, only costs related to sensorineural hearing loss were included, not the cognitive costs. And antiviral treatment may get more effective. Like, it's almost assured that it's likely to get more effective. And the diagnostic costs are likely to decrease as well. One more huge advantage is that you avoid the diagnostic odyssey. This is like, something's wrong with your kid. We don't know what it is. We're going to test him for this. We're going to test him for that. We're going to test him for that. As a parent, that's not a pleasant experience. It's brutal. So, and that poor child that's going through all that. So the diagnostic odyssey is a huge benefit. So fewer unnecessary tests. You have guidance as to what you're doing. You have comfort as a parent putting a name to the disease. And more importantly, as parents, we understand that knowing the cause for hearing loss is extremely important, and it's very meaningful for us to know, to be able to associate, put a name to the cause. It means a lot to us. So the guidance, the diagnostic odyssey is something that we want to avoid, and a screening at birth would do that. It would immediately identify the cause and the condition of the child. Parents want to know, and parents have the right to know. The idea, this paternalistic idea that we can't let parents know because, it's not in their best interest, in my opinion, is absurd. Studies have shown that when asked, 84% of parents have stated that they would want to know if their child has CMV, even if he or she never develops problems. We have a right to know. We are parents, and it's unfair to keep this from us. In that same vein, we created, this is an infographic that was created with the SOGC, the Society of Obstetricians and Gynecologists. We're trying to raise awareness. So this is a graphic that we think should be in every single hospital and every single obstetrician gynecologist office in the entire country. We want to raise awareness because we know that the Ontario program demonstrates that universal screening will lead to increased awareness. Informing pregnant women can reduce the risk of infection. Studies have shown that. And also, a universal screening program would therefore reduce cases. So more women are aware, less cases happen, period. That's the logic here, and we know that that would happen. Think of the same thing with fetal alcohol syndrome. Women are aware that they shouldn't drink during pregnancies, therefore there are way less cases of fetal alcohol syndrome. It's commonplace now, but it wasn't back in the day. Same thing with CMV. We need more awareness so that we can reduce infections. So now we're going to go to the criteria for newborn screening. I showed you this at the beginning. Significant public health problem. Absolutely. It's the number one cause of infant disability. Natural history is understood. We know how it happens. We know exactly how it happens, how the infection happens. We know how the babies are impacted. Appropriate test for screening is available. Boom. Checkmate. We got that one. Evidence that screening improves outcomes. We know that screening can lead to a diagnosis, and the diagnosis has a treatment. Programs that provide care after screening. I just said this, but there's a program that will allow your child to be screened for and monitored. Available resources for diagnosis and treatment. Check. Should not cause harm. It does not cause harm. The screening test is an incredibly non-invasive test, and more importantly, cost-effective. Dr. Gant, thank you for the study. We know it is cost-effective. Targeted screening. Now, briefly, I want to talk about this because we've talked about universal screening. We feel strongly that universal screening is a must and needs to be implemented. But even more importantly, targeted screening. So what targeted screening is testing just a targeted sample of the population that has failed their newborn hearing screening and or has other kind of obvious CMV related symptoms. So the medical community agrees that targeted screening should be standard of care. Why would you not? If you have a child that has failed his newborn hearing screen, why wouldn't you test for the number one cause of non-hereditary hearing loss? Why wouldn't you? It's the number one cause. You should be testing for it. So we know that targeted screening is extremely cost efficient. Targeted screening is an absolute no-brainer because now we're talking about the cost to identify one CMV infection, is less than $1,000. $1,000 to identify a CMV infection. Targeted screening is an extremely high probability of identifying children who would benefit from treatment, right? The targeted screening is such a no-brainer. It would provide diagnostic clarity. For some reason, it's not being done. And I don't want to get into why it's not being done, but we know it's not being done. Therefore, we believe a protocol or a law needs to be put in place immediately across all the provinces to make sure this happens. Canada's a bit of a world leader when it comes to CMV screening. So on this one here, Ontario became the first place on earth to implement universal screening. Manitoba has been implementing target screening protocols since 2017. There are a ton of hospitals where this has happened. This was front page news on the Globe and Mail in late 2019. There are babies that are being identified now that never were. They are being treated. This is a dramatic shift in mentality. I want to show you guys here what would happen if you didn't have the CMV screen. So this is Maddison. This is a CMV parent that I got to know. Maddison was born in May 2018, diagnosed with failed right ear, followed up, diagnostic, and pediatrician, followed up for a weight gain. A few months later, the parents started doing some research and asked for their dried blood spot card to be screened for CMV. Guess what? Child was CMV positive. Nobody had mentioned this to them. Nobody had talked to them about it. They had to do the work on their own, and then they ended up getting a positive diagnosis for CMV. They started valganciclovir, and now the child is doing, better because of the treatment. But here's the point. There was no diagnosis done. We need this in place now. If this parent wasn't a diehard, this would have never happened. So anyways, it's extremely important. This is what's happening right now. These babies are being missed everywhere. Everywhere in this country, these babies are being mixed, and we need to stop that. So the timeline, so what needs to happen? We need increase in awareness and public education. We need better knowledge for the healthcare providers. We need clinical guidelines or a protocol or a bill, an actual law that mandates doctors to do targeted screening. And we need the provincial governments to put universal screening in place as a standard of care. We have many practitioners that are eager to support. I'm going to jump over this here. To conclude, congenital CMV is prevalent. It's a leading cause of hearing loss. Late onset hearing loss is a serious disability. It poses a huge economic burden. Early hearing detection, we know that early hearing detection improves outcomes. We know that CMV is detectable, but we also know that most of the cases are missed. We know that sensorineural hearing loss is treatable. We know that screening is easy and affordable. And we know, thanks to Dr. Gann, that screening leads to cost savings. There is a precedent for universal screening. It's happening right now in Ontario, and I know firsthand that other provinces and territories are looking at it. Nunavut's looking at it real closely. Some other provinces have some legislation that's happening right now. So it is happening right now, and I'm saying here, it is time to start screening in Alberta. It's time to start screening everywhere. The last slide I have here for you guys is a thank you. All of these are children, Alberta children, that are thanking you. These are the symptomatic babies, all of these. They were caught. If you imagine these babies that are caught, think of all the ones that aren't being caught. It's an incredible amount of children every single year that we are missing, that we have an obligation and a duty to treat, to diagnose, to treat, and to improve their outcomes. Guys, thank you for tuning in. I'm Rob Tatro. Please, if you're a parent, if you're watching this and you're a CMV parent, please go to our website or send us an email. Go to cmvcanada.com, send us an email. We'd love to hear from you. We'd love for you to get involved. We have funding. We are hosting the first ever Public Health and Policy Conference for CMV outside of the US. We are hosting that in August, late August 2020. We'd love to have you there. We have funding to pay for parents to come to Ottawa. We're going to be doing a ton of work. There's a ton of momentum that is happening right now in the CMV community, and I want you to be a part of it, whether it's volunteering, whether it's helping us grassroots level, whether it's lobbying for change in your own province. You guys, we'd love to have you. We are going to make a difference. We are going to win at this, and we need your help. Guys, thank you so much for tuning in. Reach out to me personally if you'd like. rtatro@cmvcanada.com. I'd love to hear from you. Thanks, guys.